Well, June is designated as National Headache Month, but as we know, it's something that affects people all year round. And Dr. Michael Sevilla is here this morning to talk about what we can do to ease the pain. Good morning.
Good morning.
Well, there's several different types and varieties of headaches out there. Name some of them that affects people the most, I guess.
Well, I think what people are more familiar with terms like migraine headache, but there are a lot of other types of headaches. If you look at the textbooks there, some people heard of tension headaches or cluster headaches. There's even some headaches that are even associated with not having your coffee or caffeine in the morning.
I get that.
And some women have headaches associated with their period, so it's very confusing.
Now, how do you know what type of headache you have, I guess? How do you pinpoint if you have a sinus or if you have a migraine?
That's how one of the ways it's very difficult is that each headache is different and each person is different. What I try to work with my patients is to try to recognize, what specific symptoms they have, what they're associated with. Sometimes I have them write things down as far as a headache journal or a diary to try to find some patterns to help me to figure out what's going on.
Now, for people who have never had a migraine before, how do they know if it's a migraine or not?
Well, I think a lot of people just kind of notice, especially the most common things I hear about is that, well, I've never had a headache before. Now I'm having a headache. What's going on? So that's the main things I hear about. If you look at the textbooks and things, sometimes it's one-sided, sometimes it's both sides, sometimes it's affected by light, sometimes it's affected by certain smells. So it's very confusing.
Now, what can people do, I guess, to make sure that they can get rid of these headaches? Is there, there's always like Tylenol and aspirin and stuff, but is there other ways that they can relieve themselves or alleviate, I guess?
If people find a pattern, they can kind of try to avoid those certain things, especially if it's associated with foods. Most people start with some over-the-counter medicines, and I see them when over-the-counter medicines don't help, and there's some prescription options, but there's also some testing and some other types of treatments that we can try as well.
And I guess you hear all the time, and I've thought this, when you have a lot of headaches daily, every day for a while. A lot of people think they have like a brain tumor or something growing inside them. Do you hear that a lot?
Oh, I do hear that a lot. I heard a lot a couple months ago when Bret Michaels, the wrestler, had the headache and he had blood in his brain too, which is a very serious medical condition. So there are some serious medical conditions associated with headaches. So if people have a question, should definitely check with their doctor about it.
All right, Dr. Sevilla, thank you very much. We appreciate it.